transverse process of C1. I'm going to find C2. I'm going to let my fingers fall in. A little trick here you can use, guys, is if I go into a little bit of upper cervical flexion, which is going to be like a chin tuck, and it's probably helpful to think of like a chin tuck while retracting. And then I go into a little contralateral flexion. I've now lengthened those tissues quite a bit. And then I can actually experiment just to keep some slack off this muscle. And then I'm just going to do my little medial to lateral strokes, right? Looking for those densest fascicles. And then once I find an area of increased activity, I can move a little bit proximal, or a little superior and inferior. Keep in mind you want to be pretty close to where you think that nodule is before you start just kind of rubbing up and down the muscle, because you don't want to take a bunch of skin with you. That's going to be really uncomfortable. For the shoulder girdle that your scalenes attach to from the transverse processes. So hopefully you guys can kind of summarize that. I'm looking for something inside of this posterior cervical triangle that goes from the bony spikes on the side of the cervical spine to the bony floor at the top of my shoulder girdle. Now, going back to those bony spikes, if I start up closer to her head and I go anterior to posterior, where my densest fascicles are, and I got a couple good ones right there. And so once I find a good fascicle here, I can look for any nodules within that fascicle. And then I'm just going to hold this position until I get a release. Once I get a release, I can continue searching. Remember with these muscles, since we're not just dealing with